one question I often get at like parties and something is, Dr. Mike, what's one sign that somebody might have a personality disorder? And my answer is always the same. Do they have long-lasting friendships?
I know that's something I look out for with anybody I meet. I look out for what's their oldest friend. If their oldest friend is like when they were 29, red flag right away, And then other people, if they have the same friend since they were like 5, to me, always good sign whenever I see anybody that has really long-term relationships, not even just friendships. I mean, family friendships, I guess you would say.
Yes.
Dating, obviously. Yeah.
It makes intuitive sense. I mean, if someone's personality is disordered and the way they relate to themselves and other people is disordered, then it makes sense that would not be a foundation to build a long-lasting, emotionally intimate relationship with someone. So let's talk about a narcissist. Narcissism springs out of some sort of narcissistic injury. An
trauma.
Injury to one's self-esteem, one's ego, to the point where they feel like what I was saying before, that they are not intrinsically worthy of respect, admiration, love. Narcissistic injury, narcissism can spring out of an unlimited amount of different scenarios in which someone deep inside feels like they are unworthy of everything I just mentioned: love, admiration, respect. Now, the case I was outlining as far as the narcissistic patient, hedge fund owner, multimillionaire, his father left his family and left him at a young age. Talk about an injury. If my main attachment figure, my father, does not feel like I am, in my eyes, worthy enough for him to stick around in my life, what the fuck is wrong with me that I'm not worthy of love, respect, care from my own father? If my own father abandoned me and didn't feel like I was worthy of sticking around, you can see how this is one obvious example of a major injury to my sense of self and my self-esteem. If my own parent abandoned me, how can I make sure that nobody ever leaves me again? What is this most socially acceptable, bulletproof facade or person that I can be to avoid ever feeling that way again, where I am not worthy of a secure attachment?
That's a really tough problem.
And usually this stems from childhood.
Yeah.
So now they've grown up being what they feel like cannot be criticized or what cannot be unlovable. And because they've spent their life building up this like facade and this narcissistic mask, they actually haven't really developed their own their own sense of self. So part of the therapy with narcissism is dismantling this grandiose narrative. And in the beginning, it can be very painful because, again, this grandiose narrative that they put out there about themselves is what's propping them up and preventing them from entering despair.
Yeah.
So this is an example in which the path to progress is one of pain and discomfort. This is actually a common thread. The path to progress is often one that is painful and distressful, which is why it's difficult for people to make progress, especially when it has to do with their own personality.
And I would assume that it really helps having someone of your caliber and credentials to help guide them. I would be much less likely to trust one of my friends or my loved ones or somebody who wasn't as credentialed as yourself. I would be much less likely to take their advice, even though it might be right. But then when you got someone where I come into the office and it's you, well, now I'm willing to, maybe listen, take a little bit of that advice. And
that's one of the barriers for narcissists to be treated is, again, implicit in their defense. This grandiosity is that they are a very special person. They belong amongst special people, and that only special people can even comprehend or are good enough or qualified enough to treat them. Which is funny you mentioned that is, 99% of the time I don't take patients on for therapy. I refer them out.
Take patients what?
For therapy, as far as me being their therapist.
Just talking therapy.
99%, yeah. Typically I see people for half an hour once every 4 to 8 weeks. Interestingly enough, now this is anecdotal evidence based on me and my practice. The subset of patients that demand to see me for therapy, because I'm an MD, I'm a psychiatrist, I'm not a therapist, in which they kind of diminish their value. So I actually end up with a disproportionate amount of patients as far as my therapy clients that have these narcissistic traits. Because, oh no, only an MD psychiatrist would be good enough or worthy enough to treat me. This grandiose sense of self that they put out there. So I actually end up treating for therapy a lot of people that have narcissistic qualities and sometimes full-blown narcissistic personality disorder.
I guess the main thing I would like to finish on for narcissism is a pathway out of it. And, because I don't want the listeners to think that we are just talking smack on narcissists.
Yes.
And that they're crummy people. They're people just like the rest of us. They have their own issues. We all need to recognize that. And what are some things that you help them do to reintegrate themselves into a authentic life?
It's a major challenge. Narcissistic patients deserve compassion just like every other patient that I interact with. Of course, they deserve compassion. Now, if we can utilize a skill that they lack in mentalizing and looking at this person and what was the seed that grew this tree of narcissism? What was this injury? It's much easier to be compassionate with a narcissist if you can try to conceptualize that little 4-year-old child whose father abandoned him, right?
Yes.
And what he is doing to avoid the pain of feeling unworthy of love by a major attachment figure. Narcissist, what can we do? Now, when someone's coming to me for treatment for narcissistic personality disorder, which has literally never happened, not even once.
Oh, you haven't even...
Again, the narcissist does not present, hey, I'm narcissistic.
Oh, okay.
Yeah. But
let's just clarify. They're not coming to you for that problem, but you uncover that they have that problem.
Yes. Now, what do we work on? We work on their sense of self. We work on dismantling this grandiose narrative that is not in touch with reality. We work on being authentic with others. We work on regulating their anxiety and worry that they are not worthy of love. We start building their self-esteem in a systematic way. We touch on self-esteem, of course, in the first podcast. Mm-hmm. We're going to continue to touch on self-esteem as we move along this podcast. That is the basics. It's this, you're worthy of love, getting in touch with your authentic self, taking the risk and having courage on being authentic with others, and risking the rejection, because their deepest fear is not being worthy of love and love, acceptance, admiration, and respect from a group or an individual. Because again, their fundamental issue is they themselves don't feel worthy. That's the judgment they're casting on themselves. And again, a lot of this in true narcissistic personality disorder is unconscious. Mm-hmm. They don't even, they're unaware that this is the system in which they're functioning and relating to others and relating to themselves.
Okay.